Good morning. It is 6:32 a.m. on an overnight on 6/16, and I thought, what better time to record an acid-base balance lecture that you may have missed or just feel the need to re-hit it again for the overnight for Western Carolina Veterinary Emergency Hospital, okay? So we're going to just kind of briefly talk about, and again, this is a brief topic to cover it because we could go into the rabbit hole of so much more with acid base and electrolyte balances, but I just kind of want to cover some things and talk about acidosis versus alkalosis. So we have metabolic acidosis, respiratory acidosis, metabolic alkalosis, and respiratory alkalosis. Anytime you think acidosis and alkalosis, I want you to visualize that table that you had during grade school that was that 0 to 14 on that acid-base scale. So the 0 would be the most acidic side, in the middle is 7, and that's going to be a neutral space. As you go closer to 14, between that 0 to 14 space, as you go closer to 14, you're going to become more basic. So we're going to talk about what happens when the body is either too acidic or too alkalinic. And it deals with two different body systems that will affect it more so. So we have our respiratory system as well as our kidney, okay? Or this can be called the metabolic system. And I'll get into talk about all those in just a second. So first of all, why does this matter? Why do you care? And how does this help you as a veterinary technician better take care of your patients? Well, first of all, there's the homeostasis, okay? And what does homeostasis mean? Well, that's the insurance that the whole body is properly functioning, okay? That's from even a cellular level. So all of our organ systems, the biggest organ system that's going to help with homeostasis is our renal system, okay? So the renal tubules and all their functions that they need for hydration, electrolyte, and acid base, that's going to be that big organ that's going to help with all of that, okay? So also just overall proper functioning of the body. If you're able to filtrate, if you're able to keep a neutral body system, then all of the other organs are going to function on a cellular level more efficiently. Okay, so we're all about being efficient and making sure that any disease process may not hinder the overall body functioning. Okay, so let's get started. Okay, so first of all, when we are talking about acid-base balances, we have to talk about hydrogen. Hydrogen is our friend. He helps us with the world. And the hydrogen is going to help us because overall, with acid base, we're referring to the pH of the body, which describes the hydrogen ion concentrations, okay? And if you're like, what? Chemistry? No, thank you. Just walk with me for a little bit longer. And once we get to the game, the tic-tac-toe, then we'll start having some fun, okay? So overall, this pH is going to measure the hydrogen that's present in the blood, and that measurement of the hydrogen is going to balance it, either it's acidic or it's alkalinic, basic. The pH must maintain a narrow range, and you think, well, okay, great. Why does my pH have to have a narrow range? Well, if our body just for a second goes too acidic, too alkalinic, it really can throw off everything, especially on a cellular level. So overall, I want you to think, and again, this is just kind of really summarizing everything. I want you to think measuring hydrogen is the equivalent to measuring the pH in the body, okay? So then we can take that a little bit further and think about, well, what kind of environment does that entail? Well, if we have a low pH, that is going to be equal to an acidic environment, which means that overall there's an increase in our hydrogen ions. And that counterpart is if we have a high pH, that is going to be equivalent to a basic environment, which overall equals a decrease in hydrogen ions, okay? So for the body to function and maintain pH, it has to have buffers, okay? So we're talking about our pH and what happens if it's in an acidic environment and a basic environment. Well, overall, it has to have buffers. And what are buffers, you ask? Well, think of one is bicarbonate, okay? That's that main one. That's HCO3. Okay, we also have calcium carbonate and calcium phosphate. But the biggest one we're going to concentrate on is that bicarbonate. Okay, moving on to our next slide. So again, I talked about those two body systems that we need to just think about when we're talking about acid-base and how the body's going to try to fix it when it becomes too alkalinic or too acidotic. So the first one is the renal system, or your kidneys. Love your kidneys, that is important. They help to regulate and excrete hydrogen and the uptake of HCO3. Remember that HCO3 is that bicarbonate. Once a change is seen in the pH, the kidneys go to work, okay? They're going to increase and decrease levels to make sure that our body is not going to become too acidic or too alkalinic. This may take hours to potentially days. So keep that in mind. I want you to remember that. So now let's kick over to the respiratory system, your lungs. Okay, carbon dioxide is the main respiratory indicator, as we all know. Okay, we breathe out CO2. It has the same relationship with pH as hydrogen does. It's going to increase or decrease in CO2, and overall that's going to affect our pH. Okay, and the nice thing about that is because we can breathe off CO2 or hold in CO2, it's going to make a change immediately. Okay, so the lungs can help breathe off, okay, that's that CO2, which will affect our pH, and that can be an immediate change. Just like if I held my breath, which I'm not going to do, okay, CO2 would build up in my body would go through some effects, okay, either getting alkalinic, acidotic, depending on the disease condition if I had that, okay, but what I can do is I can breathe it off and immediately make that change. The kidneys, on the other hand, don't get to do that because their changes that they do, meaning with the HCO3 is that bicarbonate, it's going to take some hours to potentially days, okay? So if we have a potential disease condition, the respiratory system may go to work before the kidneys. Now, if we have a chronic condition, the respiratory system may try to fix the situation, and then they may not be able to do the job efficiently. So then our kidneys are going to get kicked in and be like, okay, I'll try to help out too. I'll see what I can do. Okay. But those are all disease specific. Okay. We'll talk about some of those disease processes with the this or that. So if we think about it, we have, and let's go over these for examples. Okay. And these are just a few examples. I'm not getting into all of them. This is just kind of just a baseline education, okay, on this. So first of all, we have metabolic acidosis, okay? The most common disorders that we'll see with this is lactic acidosis or shock, okay? And we think about it, well, lactic acidosis, okay, so if we have some sort of lack of blood flow, an obstruction, the best one that I can really relate this, especially correlating with lactate, blood lactate, is a GDV. So literally that stomach that goes in and it twists. When it makes that twist, it stops all blood flow to the rest of that GI system, which then will affect the spleen and the entire body and yada, yada, yada. So when that makes that constriction and it stops that blood flow, what happens? Well, lactic acid is going to pick up, okay, because it can't be spread. And you ask yourself, where does lactic acid come from? Well, it actually comes from a phase of the Krebs cycle, which we don't need to go into that right now, okay? So that lactic acid can build up. As that lactic acid builds up, we become more acidotic, okay? And then it falls into the metabolic acidosis category. Another example would be renal failure. This is relating to that HCO3. And how it relates is that the kidneys can't properly filtrate those hydrogen ions, so there's that buildup that's there. DKA can have this, GI losses like vomiting or diarrhea, which are affected by those, by that bicarbonate, those buffers, that HCO3. And severe metabolic acidosis, you would want to treat with some sodium bicarb. So if you don't know where that is, I would like for you to go into the hospital and go find where it is over by the injectable drugs. Okay. Then we have metabolic alkalosis. So again, when we say metabolic, we got to think our kidneys, think our renal system. So metabolic alkalosis, you could think is kidney basic. Okay. GI outflow and obstructions due to poor perfusion, this can happen. Decrease in the body system's chloride levels and overall just poor perfusion in the body can lead us to this. We then have respiratory acidosis. I threw a capnograph up here from an ECG just so that you can think about it, because the biggest thing is that's great that there's all this knowledge, and I'm always about nerding out, but how does it apply to the hospital? Okay, so capnography is that big thing, that respiratory indicators, that CO2, right? So our capnography is going to help measure that, and that's important to know. So hyperventilating and not eliminating that CO2 can create an acidic environment. So CO2 is an acid overall, and it will cause a decrease in that pH. So think back to a decrease in pH equals a blank environment, which equals a increase or decrease in those hydrogen ions. Ask yourself to look back. Respiratory alkalosis, okay, so respiratory basicness, okay, is hyperventilating and breathing off too much CO2. So it's basically the opposite, okay. So those are just some examples of this or that of what we may see: metabolic acidosis, respiratory acidosis, metabolic alkalosis, and respiratory alkalosis. So during my lecture, I had a little story time and talked about an example of one of these conditions and how it may relate to dystocia, but I kind of want to keep this suspense. I kind of don't want to give you the answer. I want you to, after this presentation, think about, why would a dystocia be one of those cases where we could have some sort of respiratory alkalosis or acidosis? Okay, so I want you to think about it. Think about a lot of pressure in the situation. Okay, moving on. Something to think about. Okay, in order for us to do this tic-tac-toe or amazing game, we have to have a reference table. Okay, so I want to use this reference table, and I've added this over by the iStat if you feel so intrigued to play the game. Our big indicator that we always have to have is our pH. Okay, we also have to have our CO2, which is our respiratory indicator, as well as our HCO3, which is our metabolic indicator. Okay, if we have a range, it has to be through that acidic or basic. For our pH, we have 7.35 and 7.45. If it's higher than 7.45, it becomes more alkalinic. If it's lower than 7.35, it becomes more acidotic. For our CO2, we have 45 and 35. I know as it trends upward, you read left to right, it's 45 then to 35, but you have to think of that acid-base scale. So if it's greater than 45 for our CO2, it's more acidotic. If it's less than 35, it becomes more basic. Our HCO3, our bicarbonate, is 22 to 26. So if it's less than 22, it's a more acidic environment. If it's greater than 26, it's a more basic environment. Okay, so let's go over some problems and see if we can figure out what type of metabolic acidosis alkalosis we're in, respiratory alkalosis acidosis. Okay, see what kind of things are going on here. Okay, you'll need your reference guide, so pull out your PowerPoint. My suggestion would be to, when you have a patient and you run an iStat EC8, not a Chem8 EC8. Why not a Chem8? The Chem8 doesn't measure pH. Okay, so grab this, take your results, tape them here, manually enter your results into that patient's clipboard, obviously, and then down here you can perform the tic-tac-toe. If you feel so intrigued to do this as a part of your life and you want an incentive by the end of the couple weeks, put this, if you've done one, on my desk. Okay, so we'll get to how that needs to be done. Okay, so you've got your reference range. First thing we need to do is set up the tic-tac-toe. Okay, I'm drawing with a mouse. It's pretty difficult, so bear with me. The first one you'll label as, oh, gold. Okay, this is supposed to say acid. Okay, the next one you'll label as neutral, but we're just going to do WNL for now. And then the third column is going to be basic, but I'm just going to write base because that's difficult. Okay, so the first thing we have to look at is that pH, 7.55. looking at our reference range, 7.55, that actually pushes more towards the alkalinic side, okay, because it's past that 7.45. So, therefore, that 7.55 is towards the basic route, okay? So, what do we then need to do? Well, we're actually going to put a pH in the basic column, okay? There's our pH. Now we look at our CO2. What's our CO2? 25. Look at your reference range. 45 to 35. Okay, so less than 35, which 25 is, that's going to be towards the basic side. So write your CO2 in that basic column. That HCO3, that metabolic indicator, is 19. Well, that's actually more towards the acidic side because it's less than 22. So we'll come over here, write HCO3. Okay, so HCO3 is over there. So now, cool. Somebody won here in tic-tac-toe, but who won? Okay, so our basic column we can circle as the winner. Okay. And why it's the winner is because it has to have that pH in that column, okay? So I'm not going to draw this out, so just kind of follow along with me as I talk about it. Because it's basic, okay, we already know that we're in some sort of alkalosis state because it won, okay? It filled those three columns up, okay? So we can put blank alkalosis. Okay, so how we know if it's respiratory or metabolic, again, is with those indicators. So CO2 was respiratory, HCO3 was metabolic. So our CO2 is in our basic column. So this automatically tells us we're in some sort of respiratory alkalosis, okay? We're not done there though, because our kidneys are actually trying to do something in this too. Because, and we know that, because our HCO3 is in the acidic column. So this means, and whenever, if HCO3 was in the middle within the normal ranges, we wouldn't have any compensation. So the body wouldn't be compensating in any sort of way due to a disease condition or the condition of the body at that time. So, but because it's in the acidic column, we would label this as partially compensated respiratory alkalosis, okay? So that is an example of one. Let me erase some things here, okay? And we'll do the second one, okay? So hopefully you got that, kind of following along. Draw this out, okay? Again, we first label acid within normal limits and base, okay? For our second problem we have a pH of 7.23. Well, where does that fall? That's more on the acidic side. Why? Because it is less than 7.35. Okay, so we can write in here our pH. Okay, now let's look at our CO2. It's 34. So that is actually more towards the basic side. Even though it's one number off, it is towards the basic side. So we're at CO2. Our HCO3 is 13. That's less than 22. So therefore, it's in the more acidic side. HCO3. So ask yourself, who won this round? Acid did. Okay. So go ahead and think blank acidosis. Okay, so HCO3 is our what indicator? Our metabolic indicator. So we have some sort of metabolic acidosis. Okay, we're not there yet. Is the body, ask yourself, is the body compensating in any way? Well, it is. The respiratory system's trying to help out too, because our or the disease process is affecting the respiratory system. Our CO2 is in the basic column, so we would say partially compensated metabolic acidosis. Okay, let's do one more, and then I'll let you go. Okay, let's write out one more. controller thing here. Okay. All right. Looking at our stuff here. Our pH is 4. Well, that actually falls into the normal range between our 7.35 and 7.45. So we can put our pH within the normal limits. Okay. So this should be telling you something as you're approaching it. Our CO2 is 39. Well, that's actually between the normal ranges, so we can write our CO2-ish here, okay? And our HCO3 is 24. That's between our normal ranges, okay? So we write HCO3, okay? So who's the winner here? The winner is a happy, healthy patient, okay? This is a happy, healthy patient. This animal's fine, okay? There's nothing going on. You ran your ISTAT and you're like, patient's good. We can do surgery, okay? Cool. So that kind of concludes my presentation. It's not a whole lot, but is a whole lot. If you want to go more, you want to nerd out with me, we can go a little bit further if you want to. But otherwise, I hope that you enjoyed this, maybe learned a little something, maybe relearned a little something. So I challenge you for the next couple weeks. As I stated in my email, I challenge you to, when you do an ISTAT EC8, go ahead and write this out, okay? The more I get, the better. And I would love to do an incentive, and it's a decent one, okay? It's probably a good one. You do it and you enter yourself into a raffle. I'll pull out names, and anybody who wants to do a little bit more work on this will be rewarded. You don't have to. I understand that sometimes this stuff is like, oh, but if you want to, no, I think that would be wonderful. So I hope that you enjoyed this, and have a wonderful morning or night. It's night for me. I'm going home, going to bed. Bye.